Understanding HIV, a primer. HIV stands for Human Immunodeficiency Virus. It's a virus that attacks the body's immune system. The immune system is like our body's defense team, protecting us from germs that can make us sick. HIV weakens the immune system, making it harder for the body to fight off infections and diseases. When HIV weakens the immune system, it can lead to a condition called AIDS, or acquired immunodeficiency syndrome. AIDS is the most advanced stage of HIV infection. People with AIDS are more likely to get serious infections that healthy people can usually fight off. It's important to remember that HIV is a manageable condition with proper medical care. Many people with HIV live long and healthy lives. Understanding HIV is the first step towards prevention and treatment. HIV's impact. Weakening the body's defenses. HIV targets specific cells in the immune system called CD4 cells, also known as T cells. These cells are crucial for a healthy immune response. When HIV enters the body, it takes over CD4 cells and uses them to make copies of itself. As HIV multiplies, it destroys CD4 cells in the process. This weakens the immune system over time. A weakened immune system makes it difficult for the body to fight off infections, even minor ones. Without treatment, HIV can severely damage the immune system, leading to a diagnosis of AIDS. At this stage, the body becomes highly susceptible to opportunistic infections. These are infections that wouldn't usually cause illness in someone with a healthy immune system. Transmission of HIV, how it spreads. HIV is transmitted through certain bodily fluids, including blood, semen, vaginal fluids, and breast milk. It can enter the body through cuts or sores in the skin, as well as through mucous membranes found in the rectum, vagina, penis, and mouth. The most common ways HIV is transmitted are through unprotected sex with an infected person and sharing needles or syringes with someone who has HIV. It's important to note that HIV cannot be transmitted through casual contact, such as hugging, shaking hands, or sharing utensils. Pregnant women with HIV can also transmit the virus to their babies during pregnancy, childbirth, or breastfeeding. However, with proper medical care, the risk of transmission from mother to child can be significantly reduced. Section 4. Prevention is key, protecting yourself and others. Preventing HIV infection involves understanding and practicing safe behaviors. One of the most effective ways to prevent HIV transmission is by using condoms correctly every time you have sex. Condoms act as a barrier, preventing the exchange of bodily fluids. Another important preventive measure is to avoid sharing needles or syringes. If you use injection drugs, it's crucial to use sterile needles and syringes every time. Needle exchange programs are available in many communities to provide clean needles and reduce the risk of HIV transmission. For people at high risk of HIV infection, such as those with partners who have HIV, there's a medication called pre-exposure prophylaxis, or PrEP. When taken daily, PrEP can significantly reduce the risk of getting HIV from sex or injection drug use. Section 5. Living with HIV, treatment and hope. While there's no cure for HIV, there are effective treatments available that allow people with HIV to live long and healthy lives. Antiretroviral therapy, or ART, is a combination of medications that work by stopping HIV from replicating in the body. ART helps to control the virus, allowing the immune system to recover and regain its ability to fight off infections. With consistent ART adherence, people with HIV can achieve and maintain an undetectable viral load. This means the amount of HIV in the blood is so low that it cannot be detected by standard tests. Having an undetectable viral load not only benefits the individual's health, but also significantly reduces the risk of transmitting HIV to others. In fact, studies have shown that people with HIV who maintain an undetectable viral load have effectively no risk of transmitting the virus sexually. In conclusion, HIV is a serious virus that attacks the body's immune system. However, with proper medical care, it is a manageable condition. By understanding the modes of transmission and practicing prevention strategies, we can protect ourselves and others from HIV infection. For those living with HIV, advancements in treatment have transformed the outlook, offering the promise of long and healthy lives. It's crucial to remember that HIV is not a death sentence, and with knowledge, compassion, and support, we can continue to make progress in the fight against this global epidemic.